Hello, welcome to another episode of Boomer Health at Home, the show where we provide useful information to help you live a happy, healthy life. I'm your host, Brett Pulte, and one of the biggest parts of the medical equipment industry is orthotics. So to help us understand more about orthotic products today, we have Karen Eland and Cheryl Dovitz joining us. So thank you guys for being with us.
Thank you for having us.
You're welcome.
So can you guys give us a brief overview of your credentials?
Okay, well, I'm a certified fitter.
Good.
And I work for AmeriCare.
Good. And Cheryl?
I'm a sales and marketing representative for OTC and Trueform products.
Oh, perfect. Good. It sounds like we got the best people for the job today. So our topic today is orthotic equipment, and can you guys give us, just a brief explanation of what that really entails?
Okay, an orthotic device is actually used to keep the body in alignment.
Okay.
All of our joints and muscles are aligned. If we injure, we have to put it back into an alignment, and that's what a brace is. It's just to get us back to that correct positioning.
Perfect. Good. So, there's some other products too that can go in with orthotics, the support stockings, compression hose, things of that nature. And, my parents are now starting to get into, their late 50s, early 60s, and they're starting to wear support stockings. And, my big question is, you hear the terms support stocking, compression hose. What's the difference in those, Cheryl?
Very similar,
Okay.
except for the sizing and the compression. A
Okay.
support is, someone that needs a support, so it's a lower compression.
Gotcha.
Whereas a compression or the medical grade are a higher compression. Usually a doctor will recommend those, and they'll tell you what compression they recommend, and you usually need a script.
Okay. And then that would be where Karen comes in to fit them properly.
Yeah,
Correct.
absolutely.
Yes.
Well, that's good. That's definitely, something that's needed for sure. And, I know you said that, doctor's going to prescribe something with a higher compression. How do you know what compression is really needed?
A lot of it is up to the doctor.
Okay.
But again, if someone just needs, maybe they have a little vein issue, or they want to use it as preventative, which is a big thing now. People who are in the car for long periods of time, if they're flying or if they're standing on their feet, that's more preventative. So you don't need that higher compression. You need more of the support, like a 15 to 20.
Okay, it's just a little extra help to help. Okay, good. So what type of conditions are treated with compression stockings,
The
Karen?
conditions, well, we can start with, in our preventative, tired, achy legs, the travel. We can go into then the vascular issues like the varicose veins, things like that, edema, severe edema, chronic edema, and that's when we start working off a doctor's prescriptions.
Okay.
When we have those diagnosis is a little bit more severe, we want to go right off of the order, what the doctor wants, and the height of the stocking that the doctor wants.
Good, good.
Yeah.
I'm also hearing that athletes are using compression stockings these days. Why is that beneficial to an athlete?
Recovery.
Recovery.
Oh, good.
Yeah,
For sure.
what you're doing is you're putting
Yeah.
the blood flow, which is allowing the muscle to get the oxygen quicker, so the recovery time is much quicker.
So it's gonna-
for a runner, somebody who runs, you'll have that little stiffness, but
Yeah.
they won't have it as long.
So what you're saying is it kind of, all the little damage that you do to your muscles while working out and exercise and being athletic, it kind of helps to recover quicker.
Yes, much
Yes.
quicker.
That's good. That's good. Now, you also mentioned braces, and I see we've got a few of them set out here.
Right.
So what are the major type of braces? What do we have here?
Okay, well, we'll go from the back on up. Okay, the back for your lumbar strains and sprains. There's a couple different types that we have. We have this one here that's a little bit more controlling, and it's going to give you more compression for the lower back and up to the mid-spine, okay? This is just something for a real general strain, and it's more of the elastic type. It's a little bit more breathable. It's narrower. Just a Velcro closure in the front.
Yeah, and it looks like one of the major differences between this one and the first one. This one doesn't, it just kind of wraps around you. This one looks like it's going to have more of a pull system.
Right, you have an additional pull system, so it Velcros in the front. And then we have the additional pulls to tighten it in, just to give us that better fit.
Gotcha. Okay. Good, good. So what other ones do we have here?
Okay, we
Got
have
a whole array.
Yeah, we do. We have our knee braces, and we carry knee braces that'll go all the way from just a neoprene sleeve with an open patella for something that's very minor, a sprain, an occasional ache, you know, and you just want to keep yourself active, you know, so while you're doing that activity, having a neoprene sleeve on is helpful.
Gotcha. Yeah.
Then we can go into having stays on the side, which give us a little bit more lateral support.
Yeah.
Then we can go into something more with actually metal hinges, which which again, now when we go into metal, that's something that the doctor has to be involved in, so the doctor's going to recommend that.
Okay. So that's a little interesting. I guess I never realized there's prescription braces and just over the counter.
Yeah, definitely.
So, you know, how does a brace help a joint, Cheryl?
Well, if you have an injury or a tear or sprain or anything, for example, the wrist brace will help keep it immobile, or it will help keep it supportive.
Gotcha.
So that way you're not re-injuring it, you're not supportive. You know, someone with, for example, carpal tunnel, they're constantly using that motion.
Yeah.
Having a brace while, if they know, you know, someone who's typing a lot or keyboarding, wearing a brace will help support it, so they're not making the injury worse.
Okay, and I'm sure that's, you know, same for most braces. I know I've used a knee brace myself in my younger years playing hockey. You know, you get that little ache that just won't go away. So you want that little extra help.
Right.
That's good. So are braces meant for long-term use or just kind of short-term?
Well, it really depends on the injury. You know, it really does. There's a lot that you want to use as a short term and just while you're in that activity. Then there's some that, you know, you do have to wear longer. But that, again, when we start talking the longer terms, we're talking, you know, your physician's involved, and they're going to give us directives on how long you're to wear it.
Okay, so the physician will essentially say, you know, you need this brace with, you know, this in it for this long.
Right.
Okay, good. It kind of seems like a lot of things now, especially doing the show for a couple of years now, I'm learning more and more that things I had thought, okay, I'll just go in and buy, you know, a brace. Well, maybe the doctor says I need something more. Right.
And you know, a lot of people do come in and they buy like so let's say for a knee brace, they'll buy just the basic neoprene, and then they'll find, yes, it gives me some, but I'm still kind of having that pain. So it's recommended that they go visit their physician. The physician does the evaluation, and needless to say, if there's swelling or, you know, the pain increases, you need to see the physician right away.
Gotcha.
You know, so just
kind of keep an eye on it.
Yeah,
just like everything else.
Definitely.
Good. So you also said, or we also mentioned like slings and splints, and I see we have a wrist splint here. You know, what are the different types of slings and splints that are really out there?
Well, splinting and bracing are kind of the same, okay? You can think of a splint as like, let's say you're in an emergency situation and they put a splint, you know, underneath just to immobilize. Well, that's basically what some bracing is doing, like this wrist splint for carpal tunnel. You know, this is a firm metal spoon in here, so it's keeping the wrist in the neutral position. You know, so it's just like a splint, but it's easier, okay? A splint is normally wrapped around or something like that, but this, it's easy to put on and off for home use. Normally when you're splinting someone, you're splinting them, or the physician or someone else is splinting them. They're not doing it themselves.
Yeah, and that's something, you know, I thought too. You know, I was a Boy Scout for a brief time in my younger years, so we got taught first aid, and you know, someone rolls their ankle out in the woods, grab a couple sticks, tie them all together, there's your splint. But are splints meant for long-term use?
Splinting like that? Not necessarily.
Well, you know, I don't expect someone to walk around with sticks for
Needless to say, you're going to get it evaluated, and there may be like that ankle that you're talking about. Possibly a air cast would be needed. That is another type of splint, but it is something that is removable, but it's going to hold that joint in place and firm.
Okay. And then, I was just going to jump in. Later on, depending on what the injury was, let's say you were playing basketball, the doctor might say, okay, it's healed, but maybe you have a tendency to roll it, wear the neoprene or wear something while you're doing that activity to keep it.
Yeah, because I know I broke my ankle about 10 years ago, and ever since then, you know, I never really went back for the follow-up visits because, you know, I was 21, and you know, that's what you do. So now I've got a lot of crunching and stuff sometimes when I, you know, roll the joints, and every now and again I'll have some massive pain in it, toss my brace on, and go for the day and be good. Yeah, Generally when I think of slings, all I'm thinking of is, your arm up like this. Is that the only type of sling, or are there different ones?
There's slings that are for, just like your envelope sling. There's ones that are immobilizing the shoulder. There's several different types of slings for that, but, you're not going to put a sling on a leg or anything like that, so it's basically upper body.
Okay, good. So, what would you say is the most common piece of orthotic equipment that you see?
I see a lot of back, I see a lot of knee, and a lot of ankle.
Yeah.
And then we go into our carpal tunnel splints, and we do a lot of carpal tunnel, The wrists we do see a lot, and, a lot of times the doctor will recommend that they're doing these wrist splints, and if it is truly carpal tunnel, they just have to wear it at night. So throughout the day, they have the relief, but when they get home, they put it on at bedtime.
Yeah, and, you said with the carpal tunnel and the wrist splints, is there, a certain age people should be watching for? I mean, we all know it's from repetitive motion, and nowadays everyone's typing.
Even you can get it just the way we sleep. Sometimes we like to sleep, we like to grab our pillows, and we bend out, not even realizing what you're doing. You can have that hand and wrist out, so.
I never thought of that.
Yeah. People wake up with stiffness because of that, so. That's what these are for also.
That's definitely an interesting piece to that. You always think it's the repetitive motion, like I said.
Well,
but
that's the main cause,
it's sometimes just having it extended.
Right,
That's pretty interesting. Good. Well, that's all the time we have today. Karen, Cheryl, thank you very much for joining us. And you guys gave us a lot of great information, a lot of things I learned too. And you at home, if you have any questions at all, please feel free to give us a call at 248-288-2270 or drop us an email at boomerhealth@americamedical.com. Have a great day.